Hello and welcome back to Note to Pharm.D. My name is Dr. Anderson. I am a licensed pharmacist here in New York City. And at the end of this video, please don't forget to like, comment, and subscribe for weekly videos. So now we're jumping into part 4 of the top 300 drugs. I will voice the generic, brand name, and indication for 50 more drugs off the top 300 drugs, McGraw's 2016 pharmacy drug card list. So jumping right into it, lansoprazole, Prevacid, gastric ulcer disease, GERD, Zollinger-Ellison syndrome, latanoprost, Xalatin, ocular hypertension, levobuterol, Xopenex, asthma, levetiracetam, Keppra, seizures, levocetirizine, Xyzal, allergic rhinitis, levofloxacin, Levaquin, fluoroquinolone antibiotic. You'll typically see this used in like community-acquired pneumonia or pyelonephritis, etc. Levothyroxine, Synthroid, hypothyroidism, lidocaine patch, lidoderm, neuralgia, linagliptin, Tradjenta, type 2 diabetes, liraglutide, Victoza, type 2 diabetes, lisdexamfetamine, Vyvanse, ADHD, lisinopril, Prinavil, heart failure, hypertension, and acute MI. MI meaning myocardial infarction. Lithium carbonate, Lithobid, bipolar disorder. Lorazepam, Ativan, anxiety, insomnia. Losartan, Cozar, hypertension, heart failure. Lodiprednol, Lotemax, allergic conjunctivitis, postoperative inflammation, conjunctival sac. Lovastatin, Altoprev, coronary arterial sclerosis. Lupripostone, Amitza, irritable bowel syndrome with constipation. Maraviroc, Solzentry, HIV infection. Measles, mumps, rubella vaccine, MMR, prevention of MMR, and this is a live vaccine, just to indicate that. Meclizine, Dramamine, motion sickness, vertigo. Medroxyprogesterone, Provera, abnormal uterine bleeding. Meloxicam, Mobic, osteo or rheumatoid arthritis. Memantine, Namenda, Alzheimer's disease. Meningococcal vaccine, Menactra, also known as Menveo, the prevention of meningitis. Metaxalone, Scalaxin, muscle spasm. Metformin, glucophage, type 2 diabetes. Methadone, Dolophine, chronic moderate to severe pain. Methocarbamol, Robaxin, muscle spasm. Methotrexate, Trexall, psoriasis, rheumatoid arthritis, non-Hodgkin lymphoma. Methylphenidate, Ritalin, ADHD, narcolepsy. Methylprednisone, Medrol, allergic, dermatologic, and endocrine disorders. Metoclopramide, Reglan, GERD or diabetic gastroparesis. Metoprolol, Toprol XL if we are talking about metoprolol succinate, and Lopressor if we are talking about metoprolol tartrate, indicated for hypertension, heart failure, and angina. Metronidazole, Flagyl, for bacterial vaginosis or trichomoniasis. Minocycline, Minosin, this is a tetracycline antibiotic. You'll typically see this used to treat acne. Mirtazapine, Remeron, depression. Modafinil, Provigil, narcolepsy or obstructive sleep apnea. Mometazone in the nasal formulation, Nasonex, allergic rhinitis. Montelukast, singular, asthma, allergic rhinitis. Morphine, the extended release formulation, MS Contin, for chronic, moderate to severe pain. Moxifloxacin, Avelox, this is a fluoroquinolone antibiotic, typically seen in skin and soft tissue infections, infective COPD exacerbation, or community-acquired pneumonia. Moxifloxacin, the ophthalmic formulation, Vigamox, for bacterial conjunctivitis. Mupirocin, Bactroban, Impetigo, or eradication of nasal colonization of MRSA. Naproxen, Naproxen, osteo or rheumatoid arthritis, gout, fever, or pain. Nebivolol, Bistolic, hypertension. Niacin, Niaspan, coronary arteriosclerosis or dyslipidemia. Nifedipine, Procardia, hypertension, stable or variant angina. Nitazoxanide, Alinea, diarrhea caused by C. parvum or G. lamblia. Nifurantoin, macrobid, for urinary tract infection. Please use this opportunity to assess if everything is clear, comment for any questions or clarifications. And here is just a little, here's just a few slides, few questions to test yourself. What is the generic name for Lopressor? What is the indication for metronidazole? And lastly, list 3 drugs with an indication for hypertension. Just to recap today's class, we've listed the generic brand and indication for 50 more drugs off of the McGraw's top 300 drug card list. And lastly, we went over 3 activity questions at the end. Thank you for a lovely session. Please remember to check back every week for more pharmacy lessons.